12, there's I've done lots of Microsoft Teams meetings within my own organization. Looking at it through this platform, it seems like there's a real opportunity for our networking considerations so that we can maybe figure out a way to identify who represents which type of industry, so that way we can still maybe capitalize after the meeting. If we want to talk with somebody, maybe we could do that without individually asking, hey Lee, where do you work? Hey Christy, where do you work? And maybe have some interaction that way. So I'll think on that and see if we can't do something there. Otherwise, welcome everybody. My name is Dennis Hughes, acting president of the Cascade chapter, and there's been so many great professionals that have helped pull this together as we're learning to adapt to our virtual considerations. And thanks everybody for joining. So this is our Cascade chapter October 2020 monthly meeting, and we've been a little disconnected for a while, and we certainly want to get back to serving our members, our current members, and also continuing to gain some new members and provide an opportunity for our safety professional community to network and meet together and continue to grow professionally as well. So for anyone that's on the line, looks like we're up to 18 folks so far. If you would like more information on ASSP, maybe this is your first time, then if you could please email, my email address is there on the screen. And then also if you are here, you probably got the email from Twyla from Christy via Twyla. And there's some information to our actual webpage on there as well that you could explore. But if you'd like to just have a conversation, feel free to email me and we can talk about that. Otherwise, I wanted to jump right into talking about our chapter officers. So we've had a little bit of a lull through our summer, and just to reconnect everybody, we're going to talk about who's kind of doing what these days and if anyone else is interested to participate. So starting off, introduce myself as the current chapter president, our secretary, treasurer, newsletter, editor, program chairs, and past president. We've got them all listed there. And then we have a few more for our chapter officers as well. So a lot of these we just brought over from the last term. So if you're surprised to see your name up there, look at it as a fun surprise. But if anyone would like to discuss some of these appointments, we can certainly do that. And the discussion would be if you wanted to take on more responsibility, not that you would get out of what you're already listed for, of course. Just kidding. We do have a couple of openings right now. We do have an opening for a vice president and also a conference chairperson. So if you are interested in taking on a little bit more within our volunteer community, then again, you could use that same email that I showed at the beginning, or the email that you received access to this meeting from, and then we can have those discussions. So a quick review of recent events so that we give our guest speaker plenty of time. Of course, we've had our wildfires lately in our community, and we've had great improvement in that as far as controlling what's existed, but we still have all that residual damage that's happened in all of our family and community that's been impacted from that. So continue thoughts and prayers for those that have been impacted, and that we continue on our path of control of those. And then also some recent events regarding the diversity, equity, and inclusion. And ASSP does have a position statement related to that. And there's actually a task force that carries that name. So if you're interested in ASSP's stance on that, then I encourage you to go to the web page. Either the Cascade chapter could get you there, or you could just Google. There's some good work from the society in that direction. And then of course we have COVID, which we talked about during our last meeting, where we had Mr. Michael Wood here to discuss some of the current ever evolving guidelines and standards that we have to help navigate this challenging time. So we are considering having a little bit more of a discussion of how the OSHA standard will look perhaps for our next meeting, but we're going to work that out in the meantime. But expect some more information about ASSP benefits, membership, and resources, and probably a discussion on COVID and maybe some other topics for our next month. So trying to make sure that we're aware of the time, I'd like to go ahead and turn it over to our guest speaker, Liz Hill, and one of our program co-chairs, Christy Hayden, is going to do our introduction. Thanks, Christy.
Still on mute. I do that all the time. Welcome to the awkwardness of virtual meetings, right? So today we're super excited. We've got Liz Hill here to talk to us about being stressed out from the pandemic and how total worker health can help us. So here's Liz's bio. She's the Total Worker Health Advisor for SAIF Corporation. Liz has 20+ years of experience in professional health and safety and a short stint of international health work. Prior to working at SAIF, Liz worked in a variety of industries from oil and gas to higher education. Liz has a Bachelor of Science in Industrial Hygiene from Utah State University and a Master's of Public Health from Oregon State University. She has designations as a Certified Industrial Hygienist and a Certified Safety Professional. She is currently serving on the American Industrial Hygiene Association's Total Worker Health Advisory Group as the chair of the AIHA Safety Committee. That's a mouthful. Anyway, thank you so much, Liz, for spending time with us. And before I hand it to you, I just want to tell the group I will be monitoring chats. And if you have a question, you can either interject or raise your hand. So I'll try to help in that way. And we are recording the meeting, and I will send out a link and any documents to you after the meeting. So thanks for your time. And thank you, Liz, for your presentation today.
Hi, everyone. I'm just so happy to be here. And this is one of my topics that I love to talk about. You know, it's really a passion of mine. And as I took the Total Worker Health Advisor role here at SAIF, one of the things I really wanted to see us expand and work on and help those of you that are our policyholders, but also kind of foster a broader conversation about mental well-being in the workplace. So very happy to be here. And this is a presentation that I've done multiple times for different folks. I've added specifically some COVID-19 stress data to it, and I'll talk a little bit about that more. And thank you, Christy, for being a moderator. I found when I'm on Teams and I'm doing presentations, I really chat very well. So there are a couple points where I'll ask you to throw some stuff up in the chat, and I'm just looking forward to hearing what you all have to say. So with that, let's go ahead and get started. And if at any time you can't see my slides, if you just give Christy the high sign, we'll work something out. So thank you. So first of all, and this is where I really want you to kind of throw some ideas into the chat box, is how does work influence our health and well-being? If we think about work, what is it doing for us? I mean, this can be either in a positive way or in maybe a not so positive way. So I don't know if you're seeing anything, Christy, but I'm going to go ahead and kind of set some basics down that we talk about. This is a question I ask a lot when I do presentations. I mean, it's really just to start thinking about that thought process. I mean, there's the obvious things in terms of work determines our risk a lot of times for injury and illness. It provides access to benefits, and this is going to be really important as we talk a little bit more about stress later in the presentation. The wage that we make and the location that we work really influences our health as well. So think about how that might be. Some of the other things that we talk a lot about is how's your commute? What does that look like for you? For some people, it might be a short one to their living room right now, or for some folks that are still going into their workplace, it could be long, and we know that commutes add stress. They reduce the amount of sleep you can get. They give you exposure to other things that are maybe not so great for you. Work also controls a lot of things about our daily life, in our schedule, time for physical activity, healthy eating, how's our relationship with our families, time for things that our children or other family members might need support from us. And very importantly, it also influences how much sleep we get in a number of different ways. So I just am trying to frame up, because what I'm going to get into next is why total worker health is one way to look at this and might be one way to get at it that is going to be protective, promote health, and also prevent that injury illness. So one of the things we talk about in total worker health is that it's really a way of thinking about how we do the work we do in a way that will prevent injury and illness. And it's very important to think about protection from workplace hazards and exposures. And when I talk about workplace hazards and exposures, I'm including the ones that we typically think about as health and safety professionals, like chemical hazards, physical hazards, maybe biological hazards and exposures, but also things like psychosocial hazards, in which stress would be one of those. What are our fatigue hazards in the workplace? Are there other things that we are maybe not aware of right now or thinking about as safety and health professionals that would be considered a well-being hazard that's going on at work? The next thing we're going to do is really promote with programs, policies, and practices that can grow health at home, at work, and in the community. And the reason we want to do all of those things is around this concept of getting to worker well-being. So above and beyond just keeping someone safe at work, how can we make sure that we're getting to enhancing well-being of the people that work with us and for us? So let's talk a little bit about what stress does for us in the body. And one of the things I really want to emphasize here is that there's some people call it good stress and some, as compared to bad stress, but really our bodies are really well equipped to handle stress in small doses. So not all stress is bad, and really we're never going to get to that we have no stress at all in our lives, but we do know that our body can take those small doses. What the problem is that when we have long-term or chronic stress, it can have really serious effects on our body. We're going to see things like energy and mood impacts, digestive impacts, pain, immunity, and circulation. So if we think about this chronic stress that's happening, those are the body systems that it's acting on. And I don't know about you, but an increased heart rate, respiration, blood pressure, and blood clotting doesn't sound really that fun. We know stress can lead to those things. Have a greater inflammation response when something happens. So that means we're going to react with more redness, swelling, heat, and pain to things that happen to our body. We're going to see decreased protein synthesis and less effective digestion. And probably more importantly, and what most people see, is this energy and mood impact on the body. There are also immune response changes that happen if you're undergoing chronic stress. There's a really strong connection between how we react to exposure to pathogens and other illnesses when we are under stress. So none of that sounds really great. And so what I want to do next is talk about the sources of stress. And one of the things I want to emphasize here is I've broken this out here. And we're really going to talk about how we can do things around stress in the workplace. And one of the things that has been consistent, the American Psychological Association does a stress survey every year, and work consistently shows up as one of the main causes of stress for people. We're talking between 60 and 70% of people always identify work as one of their main causes of stress. And we're going to break that out a little bit more later in the presentation. But just know, and probably you all can relate to this, there are times when our job is probably our main source of stress, and there are times when our job isn't. But knowing that over long term, that is one of the main causes of stress for folks. And there's a lot of reasons why that might be. But then, because 2020 is what it is, we're going to throw COVID-19 on that. Here's a few ideas that I came up with. What is going on with COVID-19 in people, and how does that relate to the stress they're feeling and also to the workplace? So here's a few things that I just came up with. I really like it. If you have some additional ideas, throw those into the chat box. And then I'm going to go through some survey results that the APA did this summer. And they specifically asked people about what is stressing them out about COVID. And you'll see some really interesting results, I think. So here are some things going on with COVID that might be leading to higher stress levels in folks. We know we have this social distancing because our physical distancing is one of our primary methods of really mitigating and slowing the spread of the virus that causes COVID-19. We know there are so many folks here in the US that are experiencing economic or financial stress due to the pandemic. There's a lot of people worrying about job security and do I have a job? Do I have a job now? Will I have a job in a few weeks? When can I go back to work? There are health worries, and we'll get into that. We'll dig a little bit deeper into that. So these health worries are not only am I going to get the virus, but if I do get it, how am I going to pay for the treatment that I need? Or is a family member going to get it? Is this going to keep me from going to work? There's a lot wrapped up around that. And probably one of the biggest things that we see that causes stress here is uncertainty. And you'll see that in the results that I'm going to share right now.
So Liz, we've got a couple of pieces of feedback in the chat. One is that increased stress could be related to childcare education processes, or the increased time you spend at home with family members without an escape. That was mine. And then stress related to the politicalization of COVID.
Excellent. Oh, you guys are like hitting it all. Because when I went and looked at the survey results last week, I think that you're kind of nailing it. And one thing I do want to thank you, Christy, for that thought about being at home. One of the things that I do in my personal life is I volunteer for a child abuse assessment center. And we talked at the center when people started having to stay home, and they asked all the volunteers to stay home and not come in. But one of the biggest worries was that people in domestic abuse situations were now going to be stuck at home with their abusers, and it was going to be really tough for them. So I appreciate you bringing that up. That's a hard topic to think about, but it is a real source of fear and stress for some people. So here are the survey results, and I just want to back up a little bit and give you the method. They did surveys for May, June, and July. I didn't see any for August. They haven't published August and September results yet. They were going to do surveys those months too, but here is what the survey says. I feel sort of like I'm on Family Feud right now. 78% of folks that answered the survey said they are their main source of stress, or one of their main sources of stress, was the pandemic itself. 83%, so if you look at that number, that's like incredible, said the future of the nation was one of their main sources of stress. That really gets to what I was talking about last time, that uncertainty of what's going on. So if we think about 2020, we have an election year. Everything is politicized. It seems like we're further apart from each other on different sides of the political spectrum than we ever have been. And that really, timing that with the coronavirus pandemic and, however we feel about the government's response, it's just a whole bunch of, we don't know what's going to happen next. And that is one of the things that stresses human beings out a lot. I do want to point out that you see that work is still on here. Work is 70% of the folks said work is still something that is stressful. And we're going to dive into that a little bit deeper about what is it about work that's really getting to folks. 70% of people, again, the economy is a source of stress for them. And I just want to say, I just picked the top 5 responses. There was a whole bunch more. And I think I gave you a link in the resource sheet that Christy will share to the survey itself. And you guys are welcome if you're interested to dive in a little bit deeper. But these are the top 5. And then the government response, and this is the government response to the pandemic. So 66% of people said that is really worrisome for them. Now, some of you in your comments touched on, whoa, it's a little bit different if you have children at home. And that's one of the other things I want to point out about this survey. So this is the data from everybody. One of the things that the survey folks were really particular about saying is they saw two kind of groups of people that were way more stressed out than anyone else, and that's folks, people of color, those communities, people in those communities, and parents with children under the age of 18. So I'm going to kind of dive a little bit deeper into parents because there is really a connection there. So if you look at this, these were the average reported stress levels related to the pandemic. This is on a 10-point scale. If you are a non-parent, you're hovering right around 5.5. If you are a parent with children under the age of 18, their average stress level was 6.7. So a significant difference between parents and non-parents in terms of what their stress levels are. And this is what parents said was really stressing them out. So I want you to think about what I said. Overall survey results, these are the things that are stressing folks out. And for parents, this is what's stressing themselves out. So a family member getting coronavirus, the government response to the pandemic, a much higher result there. Disrupted routines, new routines, getting at that we are spending a lot of time at home. The kids aren't doing their usual thing. It's a little nutty around here. 73% were worried about getting coronavirus themselves, 71% managing distance learning, and then 70%, and this is where it kind of starts getting related back to work, and that financial worry is meeting the basic needs. So they're talking about, are we going to be able to make our mortgage or rent payment? Are we going to be able to feed our family? If we need healthcare, are we going to be able to get that, afford that? How's that all going to work for us? This meeting basic needs one doesn't even appear if you saw in the general survey results. So very interesting, kind of hard to see. And again, the other thing that really struck me about parents is that see how tight those percentages are. Like it's not, these top 5 responses are really, really close to each other. I'm going to kind of take a look back. In 2019, the survey, the Stress in America survey that went out, these were the results. So if you contrast that with what we just looked at around in 2020, this is what's getting people stressed out. In 2019, this is what was stressing people out. Now there's some things that are similar. I mean, you could interpret the current political climate to future of the nation worries. Financial worries and economy worries are, of course, related to money and work. And mass shootings was a little surprising for me, but if we look at healthcare cost and work, they're still right up there. And those are both things that are related to the workplace and what can we do. So now that you're all stressed out about by learning a little bit more about what stresses everyone else out, I'm sure you have some of these conditions in your own life. I want to spend some time now thinking about, well, what are we going to do about it? And here is a little bit more granular breakdown. So when people say work is stressing them out, there are 9 main kind of areas or topics that really get at identifying what is it about work that's stressing you out. So I'm not going to spend a lot of time on each one of these, but if you think about it, let's look at this. We have low salaries, so wage, and then start thinking about those connections to those things that are stressing them out. So wages, and then we had healthcare cost worries, and we have, government response worries, and we have financial worries and meeting basic needs worries. And you can start seeing these connections go together. Excessive workloads. One of the things that's really interesting to me about this, and I'm fortunate enough to be working from home, is that I thought with COVID I'd have less to do, and that it's kind of the opposite. I have more to do. And I'm sure many of you are experiencing that too. In particular, when I talk to health and safety professionals across the country, everyone says we are overwhelmed in responding to this, to figure out how we can help keep the workers safe that are working for the organizations that we work with. Here's a couple other just to kind of highlight: not having enough control over job-related decisions. We'll talk about that a little bit more. The one down here in the corner, supervisor and coworker relationship. This one turns out to be really, really key. And without identifying yourselves or anything, just think about the times when you've had a really great supervisor and a really good relationship with them. And if you've ever had a supervisor that wasn't so great and that relationship was problematic, and think about the difference in your stress levels, and think about the difference in how you felt about your job. And it's so true, that old adage that people don't leave their jobs, they leave their bosses, right? So if we're looking for jobs, that we are learning more and more about how key supervision, that supervisory relationship is for helping with stress and actually health and safety and injury prevention. One of the other things I wanted to point out here, and this isn't the same for everybody. Everybody's kind of on a different scale here for these items, but conflicting demands or unclear performance expectations is another big one. So what can we do about it? One of the things that is really important, and one of the things I want to bring out, is we're going to strive for a well-being culture in our organizations. The total worker health approach really thinks about how do we make organizational adjustments, how do we address things at an organizational level, and we are really focused on eliminating or reducing exposure to all of those things we talked about versus focusing on a reactive. So when I'm talking about this, we are going to talk about the individual level things that people can do, but I really want to focus on that organizational level. How are we going to reduce or eliminate exposure to the things that are causing stress in people's lives? Another way to think about this is that there's, and one of the links I gave you in the resource sheet is called Stress at Work. This is from one of the Total Worker Health Centers of Excellence, and they've done a lot of research about stress at work, and they call it primary prevention, secondary prevention, and tertiary prevention. So the primary prevention then is going to be controlling stress by reducing a stress exposure, just what I talked about. Secondary prevention are stress controls that are aiming to modify an individual's response to the stressors. So this is things like, how are we going to teach people how to do stress management, help them cope with residual stress in the environment, and reduce harmful effects. And then finally, we're going to talk about tertiary prevention methods. And these are typically more reactive, and they really are working towards minimizing the effects of stress-related problem once they've already occurred. So this does not prevent job stress from occurring. It just is helping folks recover from the effects of stress. So when I think about things like how do we teach people resiliency, that would fit within secondary and tertiary prevention. And I want to really have us think about focusing on that primary prevention. And it really goes along well with, of course, the hierarchy of controls, where we really seek to eliminate or protect from the exposure itself, otherwise known as source control if we're talking about COVID. Okay, so what we're going to take a look at then is we're going to address work conditions. And these things might be physical environment, work organization, and psychosocial environment. If you think about it, what is causing people stress in a physical environment? And feel free to chat. But we know certain things in our physical environment cause stress. crowding, high noise levels, temperature extremes. Those things are all stressors in our physical environment. So you might think about, okay, well, we're going to take a look at those. That's one thing we're going to do. We're going to look at our physical environment. We're going to reduce that where we can, or eliminate those stressors. What about work organization? What am I even talking about when I say that? This is where we start looking at things like, what does our shift work look like? What's our supervisory structure? What are those things that we can help our employees have control over in their work environment? It might be very special things like giving frequent breaks and control of the workplace. It might be looking at shift work and thinking about, how do we do shift work better? Can we make some adjustments? It might even be things, even as we look at shift work, as specifying predictable shifts. So remember, harking back to that uncertainty. Well, if it's predictable, my shift is predictable, work is predictable, my schedule is predictable, I had some sort of input into what that schedule looks like, that worker is going to be a lot less stressed. And then thinking about the psychosocial environment. So psychosocial exposures are really that person-to-person type of exposure. And it's kind of difficult sometimes to really wrap our heads around. But that can be, what's my relationship with my supervisor? What's my relationship with my coworkers? Do I feel bullied or harassed in the workplace? Is my workload excessive? And I'm always under stress because I just have too much work to do. The other thing we can think about is we're addressing work conditions, and I kind of touched on this a little bit, is taking a look at fatigue levels in our workplace and having a great fatigue management plan. And one of the things that's really key here as we look back to what our parents stressed about is managing those work and personal demands. Right now, if you are, for example, a single parent, let's say you're an essential worker, and so you do not have the luxury of working from home to help guide your child's distance learning, or with their homework, or making sure they're on Zoom when they need to be on Zoom and interacting with their teachers. And maybe you are assigning that to an older child to help with that, or maybe you're just hoping your child does what they need to do while you're at work. Just think of that stress level. So as an organization, if we're looking at that particular worker and saying, how can we support them meet both our work demands and personal demands, you can start thinking of solutions that don't necessarily rely on that person learning how to be more resilient. It's like, how do we support as an organization those things that that person needs to do to get their work done, but also make sure that their family is taken care of. One of the other things that we know is increasingly important is to design jobs that provide meaning, that have stimulation, that have opportunities for your workers to use the skills that they are most proud of, but also to learn new skills. So when I say address work conditions, it's really, for me, encouraging to know that as we take this approach, that we can be really creative, and it kind of is really wide open how we can help address stress by looking at those work conditions. One of the other things that organizations can do is really support engagement. And this might be engagement by making sure that your workers are engaged in processes and procedures and identifying problems and solutions that impact their work. But it's also thinking about, how do we provide purpose, autonomy, learning, and value for the people that are working for us? And this might look different for a lot of different people. And again, I can't emphasize enough that supervisor relationship becomes really important here. So if we think about who we have as supervisors, how did we prepare them to be supervisors? What are the things that they need to be good supervisors? Do we need to have some education going on? Do we need to have some practice? What are our policies and programs around supervision that will help support them? Do they know the things that they need to know to help support and have that foster those good relationships with employees? One of the other things that's important here is really thinking about how do we clearly define workers' roles and responsibilities. Anything we can do to reduce uncertainty is going to help stress levels. Thinking about how do we communicate? What is our communication system? Is it effective? Is it adding to uncertainty? Or is it really working to support our workers to know things like what are their benefits? What are career development opportunities? What are future employment prospects? So if we think about that right now in terms of COVID, what kinds of things would you want to be communicating with your employees and making sure they get the message about? What supports do you have in place? We're going to talk about benefits in a few minutes. Like, do you have an employee assistance program? Is that employee assistance program more than just, hey, you can get 7 sessions of therapy for a particular issue? Is it, yeah, we have things like, and I have a friend who just engaged with their employee assistance program to help with some elder care issues that they were having. Do you have things like elder care supports in your employee assistance program? Maybe there's some financial budgeting supports that people can really engage with through the EAP. So thinking about how are we communicating that? Is it effective? Do our supervisors know? Do our folks know? Have we removed stigma for people actually accessing those benefits that we have? And now I don't want to beat this to death, but one of the other things that's really important here is the value that people get not only from their jobs, but the value that they feel like they are to the organization and the people around them. So how are you thinking about how do we let people know that they're valued? How do they feel valued? What can we do in particular during this time to let them know that they are valued? Then finally, resilience. So this is getting down more to the individual level, but as we think about resilience as an organization, this is really providing opportunity for people to interact and to be part of an activity that's going to help their resilience. So it could be anything like this, providing opportunities for social interaction. Again, that's a little more challenging during COVID-19 days, but I know, for example, SAIF has put together virtual affinity groups, and you can go online, and if you're interested in a book club, or I'm a knitter, or I'm a photographer, you can interact with other people with like interests there. Making sure you're still providing opportunity for physical activity during work shifts, if possible. So making sure that there are breaks, even folks that, and I know one of the areas that I heard a very poignant piece on NPR the other day, and it was someone talking with healthcare workers who are in many, many cases just completely overwhelmed right now. If you are a caregiver, you are completely overwhelmed. And one of the things he asked these caregivers is, how do you go back to work every day knowing what you're facing? And he was talking in particular with some folks on the East Coast during that time where they were just completely overwhelmed. And one of the things that they said was that there was a clear connection between what they were doing and something for the greater good. So they had found meaning in being completely exhausted and taking care of folks that were ill and being overwhelmed in the emergency rooms, but they knew what they were doing was making a difference to those people that were there. So they were making a difference for the people that were in their facilities. And that's one of the most important things we can do, not only for our our mental well-being, but for reducing stress levels and getting to this resilience. If we feel like we have meaning, what we're doing has meaning, then we're going to just do a lot better. We might not be doing perfectly, but we're going to do better. Opportunities for recognition. I've talked a lot about benefits support, and one of the most important things is if we think about our benefits, how often and in the past it has been primarily focused on our physical health. And one of the things that really we've been talking about in terms of workplace mental well-being is getting to parity with our physical health benefits and our mental health benefits, making sure that if someone needs treatment for something like addiction, or they are having some mental health problems, that they get the treatments they need as if it were the same as a physical illness. Also having really robust employee assistance programs. Working on this, and I've had people tell me they don't like this term work-life balance, they prefer work-life integration, but really no, what I see this at is helping support the people that work with you or for you have the ability to meet both work demands and personal demands, so that sometimes they might have more personal demands that they need to take care of in their personal life, and having the flexibility and the support from their workplace to do those things. I'm going to highlight right now supportive supervision for just a couple slides, and I'm not going to really get into it, but on your resource sheet, I've included a link. This is one of the areas that OHSU, the Oregon Healthy Workforce Center, has really done a lot of research around, and they have several programs around supportive supervision, and that's where these materials have come from. So I've included a link to an online course that they put up specifically for how to support employees during COVID, and then some links to their website and some of their other tools around supportive supervision. One of the other things I want to highlight, and this is the in particular the SHIP program, which is a safety and health improvement program that really focuses on this idea of supportive supervision. We are working on including that in some of our SAIF resources as well. So there's just another avenue for folks to get at this. So in terms of supportive supervision, I've used this term a lot. Dr. Leslie Hammer has done almost all of her research around this, and there's two areas that she has found that really help. So if we can help supervisors understand how they can do this well, and again, it's not rocket science, this is teachable, and people can practice and they can get better as supervisors at doing these two things. One is family support, and the next one I'll talk about on the next slide is performance support. But I'm just going to spend a minute here on family support. So you've heard me say work and personal demands a lot. This is one of those where if we can do this family support, then we're really helping our employees and workers meet their personal demands that they might have. And very high level, here's the four main things that supervisors can do. That's provide emotional support and effective communication, provide instrumental support, work on win-win management, and then do good role modeling. So just very quickly, emotional support and effective communication. A lot of people might feel like they're not real great at emotional support. But you really, that doesn't mean you have to be somebody's therapist or your staff member's therapist. It's more like letting them know that they are important to you. Helping them understand that it's okay to discuss work and family related challenges. And in particular, communicating that you as a supervisor are sensitive to the impacts of work and uncertainty that COVID-19 has had on their lives. And here's just a few examples of what you might be. Like recognizing there's this wide variety of life situations and individual priorities, having and making opportunities to share those things with each other, We know this helps bring teams closer together, not pushing people to share if they don't want to share. Everyone's kind of on a different level there. And some people may not feel that comfortable sharing in an open setting. But I know that if you are open about, hey, we're kind of all in different places, you will eventually get through to those folks, and they can share where they might need support. Even if they don't share the details, that's totally fine. Blocking out time in team meetings, virtual or not virtual, to share life updates. Maintaining an open door policy. Those are all things. Skipping over to role modeling. Role modeling is really important, and this just means how you as a supervisor or manager or leader manage your own work-life integration. So what you do really signals to your work groups what is okay to do, right? So if you as a supervisor are taking off the occasional afternoon to go to support your child in a sports event, or maybe a piano recital, or a school play, or a theater group, or whatever it is that is important to your child and family, and you carve out time and you let folks know, hey, I'm going to be gone this afternoon because I'm going to support my child. That opens the doors for other people to feel more comfortable doing that. Providing instrumental support. This might be things as simple as staying up to date on what the safety and public health COVID-19 responses are that are relevant to your team, discussing those impacts on business practices with them, and making sure that you're informing your team of any changes based on what's going on with the pandemic in your workplace that might impact timelines, activities, and priorities. So again, it's just sort of, let's take out some of that uncertainty. None of us really know where the pandemic is going to end up. None of us really know if we're going to be personally impacted by us or a family member contracting the disease. But if we can take out those places where we know we have uncertainty around how is this going to impact our work, and be very clear and open with that, that's going to help. One of the other things that can be really simple for supervisors to do is make sure that people know what the paid time off and sick leave policies are, and utilizing their own time off and sick leave as appropriate, and helping them with practical solutions. And maybe that is something like schedule changes, job guidance, resources, and this goes back to helping our supervisors know what resources are available. And that could be resources from the company, it could be resources from community, it could be the things like, I know that I've been connecting folks with this state paid time off fund. So for folks that may not have sick leave at work, there is a fund out there that provides sick leave for people who had to miss work for COVID-19, for example. It could be setting regular one-on-ones. So there's a whole bunch of things that go around this family support, and I've only given a few examples. Christy will also be sending out my slides that have a bunch of notes, and the details are again in that link that I sent for the online course. But again, these are the things that are really important to people. And if we look at those competing demands between work and family, knowing that your supervisor not only understands that you might have competing demands, but is doing everything that they can to support you meeting both of those demands is really going to help with stress. All right, next, just really a little bit of time on performance support. And this really, again, it's not rocket science. So when we talk about performance support, most of us are really interested in, hey, am I doing okay at my job? And as we looked at those areas of what is stressing people out about their work, this is really one of them. What can we do as advisors and leaders to help that? So that's providing clear measurement and direction, getting to great feedback and coaching, providing resources. And here, this providing resources goes back to, again, some of the stuff I was talking about in family support around what are the benefits that are available to you? How can I help you connect that? One of the things we know from other work that I have done is that if you have an employee assistance program, it's surprising how many people do not know that that exists. And the other thing is that there's a lot of reluctance to engage with an employee assistance program. But we know that people are 80% or so more likely if their supervisor is the one that says, hey, we have an employee assistance program, here's the number, and even better, gives an example. I called the employee assistance program because I was having an issue, in my family that I really needed some help with. People are way more likely to engage and get the support they need if their supervisor is not only providing reputable resources, but able to give an example of how they utilize those resources as well. Again, for performance support. And so we're talking not only how am I doing, but what support do I have in the organization to do the job that I need to do and do it well. So when we talk about that, one of the most important things, of course, is what health protections are in place. So when we're talking about this, we're like, have we protected against the hazards so they can focus on their job? What health promotion activities and programs do we have so they can be the healthiest they can be as they come into work? We know that healthy workers are safer workers. They're also more efficient and effective workers, and we see productivity go up when we are really supporting health in the workplace as well. So as we think about that supervisor relationship, again, is really important in letting people know what things are available to them, but also modeling that, I hesitate to say this, that good behavior and engagement with the resources that are available. So what benefits are we talking about then? And I just realized that I did this for the city of Portland, and I have some details in my notes about their particular benefits. So Christy, if you would delete those before you send it out, that would be great. So when we talk about, and I've mentioned this before, what benefits should we be thinking about if we are really looking at how do we help with stress levels of our employees? Mental emotional health parity with physical health coverage is really the number one way. Most organizations are quite a ways away from getting to that parity, but it should definitely be a goal that they're aiming for. And then the second one I already mentioned is employee assistance program and having a really robust employee assistance program. There are folks that have, separate addiction help programs, but again, making sure that that is in there somewhere. So that folks that are struggling with addiction or substance abuse can really get the support and help they need as well. Substance abuse, can be an inappropriate response to stress as well. So if we can help folks with that, we are definitely helping with their stress levels. And finally, I want to talk a little bit specifically about fatigue and what employers can do to help with fatigue levels. Stress and fatigue have a very troubled relationship. Stress leads to quite often not being able to sleep well. And the opposite thing is also true. If you're not getting adequate sleep, then you are going to have a greater stress response than if you were. So here are just a few things. And again, fatigue is one of those topics that, we could spend days talking about. So these are some really high level things that we know or have learned that really help with fatigue. And that first one is evaluating workload. So that goes back to what I was talking about, is how do we get at eliminating that exposure to stress or reducing exposure to stress. and those work conditions that lead to stress response. So evaluating your workload, really thinking about evening and weekend work. How does that work? Maybe for those folks, the parents that we talked about, maybe helping them adjust that schedule so they can do their work in the evening, and maybe on the weekend that will help them support their kids through school if that's what they're needing to do at this time. But then again, really balancing so that it's not skewed one way or the other. Providing sleep disorder evaluation and resources is really important. Having that sleep disorder evaluation part of your benefits package. I know some companies have even gone further and have provided benefit to help purchase equipment if someone needs a CPAP or something to help with a sleep disorder. Providing supportive supervisor training, so making sure you're preparing your supervisors the best you can. To be supervisors might be something as simple. And one of the things I want to say here is that this should be similar to what we do for COVID, a layered approach. So not that we're picking one of these, but we're looking to see how these might work in conjunction with each other. So having some lunch and learns. This can be beneficial to talk about good sleep hygiene, for example, how to set up bedrooms, how to think about your workload, all those things. And then if you have night work, really thinking about that night shift and how you can enhance the night work by providing things like healthy foods, taking a strong look at your lighting. Sunglasses are not going to be appropriate for everywhere, but maybe you think about blue blocking eyewear, and then really educating yourself with facts about the circadian rhythm and how that can impact the work cycle that you see on night work, but also making sure that you're supporting your night workers as they go through that circadian rhythm with what they need to be at their best. Okay, so now just a quick second. We only have 3 minutes left, so actually we're going to skip that, but think about what your organization is doing that's fairly good, and then think about what your organization could do. And I'm going to spend, and you'll see that I am not going to spend much time here on the individual, but it is important. So as organizations and as individuals, these are things that we can think about in making sure that we are doing what we should do in conjunction with our organization. So as we think about this, I want you to kind of think about how does this look different during or after the pandemic? And one of the things that has really come to the forefront here is where people get their information from can really have an impact on their stress levels. So if folks are getting information from reputable sources, that minimizes the effects, that minimizes stress levels because you're getting accurate information. That is really important when we think about coping and resilience, because if we're overwhelmed, we can get to unhealthy coping. Other things I kind of want you to think about here is working remotely during COVID. What has that done to our social supports? How can we maintain our social support while we're working remotely? You know, it's interesting how different people have done this. For myself, for the first few months, I didn't want to talk to anybody. I was kind of in my little hole. But what I've done recently is I've started scheduling half-hour check-ins with people and blocking off a little bit of time on my calendar to talk with folks and make sure that, you know, just check in with them. How's it going? What's going on in your life? Here's what's going on in mine, and just having a chat as normal as I can. And that really has helped. Some people might want to join a larger group. And really thinking about how am I maintaining social support, and how as an organization are we helping individuals maintain social support, maybe within the work networks, but also within their families and personal networks. Self-care becomes important, and this looks different for everybody. And this can be as simple as just having a daily habit. I know lots of folks that take a walk after they eat their lunch, whether they're at work or whether they're working from home. For me, I love to get out in my garden after work for, an hour or so, and that's something that helps me relax and feel good, whatever it is. Make sure you have set aside time for yourself to take care of yourself and do your relaxing. And I've talked about adequate sleep a whole bunch. Maybe a couple other thoughts to keep in mind as we think about our own selves and our organization, making sure that we act with respect, not only to other people, but to ourselves, can be really important in helping our stress levels as well. Again, think about what you as yourself are doing pretty good and some additional things you might do a little better. Finally, one of the things that is most important is just to talk about it. Be very matter of fact, share your experience, receive others. Remember that workers and as individuals, our emotional state has a big impact on our productivity and overall life satisfaction. Making sure that we just talk about, hey, we're all kind of stressed. Here's some things that helped me as far as stress management. Here's some things that our organization is doing that might help you with your own stress management. And really helping folks detect any issues that they might be having early. Just keeping watch over each other. And with that, I just wanted to give you some really quick, there's lots of resources out here. Lines for Life has several different lines that people can call that will help with specific issues. The Suicide Prevention Lifeline is not just if you're contemplating suicide or have suicidal ideation. If you are having an emotional distress at any time, the folks at the Lifeline are happy to talk and help you work through it. There is some specific veterans crisis lines, and the crisis text line is available and confidential to anyone as well. And I believe I went over a couple minutes over time, but thank you very much for your time and attention. And Christy will be sharing the slides and a resource sheet that I've put together.
I totally will. And thank you, Liz, for that. That was absolutely fantastic information. And I love the focus on how your organization can support individuals. A lot of times these presentations are focused on just one-on-one as opposed to the policies and procedures. So that's awesome. Thank you so much. Do you have a minute for questions if anyone has any questions?
Yeah, I sure do.
Okay. Any questions, folks?
Liz, sorry, hold on. Hand is up. Hey, Liz, are you on this PowerPoint? Because I'm sure Christy is going to share this recording, but is it possible that we have actually the PowerPoint, maybe after it's sanitized correctly or whatever, be provided to us?
Mm-hmm. I've actually sent, and I'll clean it up because I realized I had some stuff in there that not everyone needs to see. I do have the PDF of that to Christy, and she can share that out. It is SAIF branded, so the only thing I ask is you're welcome to share that with people, but just don't remove the branding, so people know where it's coming from.
100%. Yep. Thank you.
Mm-hmm.
All right. Any other questions from anyone? I also will say I really appreciate the conversation about sort of destigmatizing, EAP and mental health services. I know I appreciate going when I have situations popping up, and sometimes I feel like I need to go in for a little tune-up, right? Just sort of a recalibrating of my bearings. And so I think sometimes as leaders, we're a little uncomfortable talking about that vulnerability that I'm a human being and not a robot. And I think the more we do that, I think that's really valuable for our people to see we're human too. So Thank you, Liz, and thank you to the SAIF Corporation too. You guys are always really fantastic partners. For not all of us are clients of SAIF Corporation, and I just really appreciate how you share your safety knowledge with everyone for the betterment of our workers and for the world. So thank you for that. Appreciate it.
You're most welcome.
All right. Well, and like I said, I will send out the documents as soon as I have them and the recording. Those of you who have been watching the chat, we had some technical problems with sharing the documents, so they will be coming via email in the very near future. So thank you for that. And thank you all for coming. Our next meeting is November 17th, which is the Tuesday before the Thanksgiving week, and we will follow up with more information about the presentation topic in the near future. All right. Thank you everybody for coming today.
Okay, Christy, are you still there?
I am still here.
Okay, I'm going to go kind of sanitize it a little bit. I'll get that to you in just a few minutes.
Sounds good.